COVID-19, the pandemic. What are our survival behaviors? Remember, COVID-19, the illness caused by a novel coronavirus, has become a pandemic, which means many people should expect to have it around the world. Earlier in this video series, we talked about the chain of survival behaviors and the link of preventing the spread and how to prepare specifically for COVID-19 regarding over-the-counter drugs and other actions. In this video, we look at the second link, early recognition, so we can identify the need for any immediate first aid needs or put our plans into action. Fever. It's our body's defense system at work. It's a sign we can measure in people who can't necessarily communicate with us, maybe like a baby. And if we do it regularly, we can see trends. Taking a temperature is pretty easy, but there are a couple things we might want to remember. So our normal body temperature is about 98.6 degrees Fahrenheit, or 37 degrees Celsius. Your temperature often varies from 1 to 2 degrees, or a half a degree to a full degree of centigrade. Your temperature is usually lower in the morning and increases during the day, which is part of why we look at trends. It reaches its high in the late afternoon or evening. There are different locations for taking a temperature, but we try to be consistent as they have different normal temperatures. So orally, or in the mouth, you have a rectal temperature, which is taken from your bottom or somebody else's bottom, and that's about 0.3 degrees or a half a degree Fahrenheit to a full degree Fahrenheit higher than an oral temperature. For these, you also want to make sure you label your thermometers from which place they were inserted. You could also use that same type of thermometer in an armpit, or what's an axillary temperature. And that's like 0.3 degrees to a half a degree lower than an oral temperature. And there are some new thermometers that can be used near the ear or on the forehead. So you want to follow those manufacturers' directions. So the process is generally cleaning your hands first, because that's a great way to prevent the disease spread. We want to use a clean thermometer. For oral temperatures, you don't want to eat or drink anything for at least 5 minutes before using it on yourself, or the person you're taking it shouldn't eat or drink. You want to hold the thermometer in the same spot for about 40 seconds or until the digital timer beeps and lets you know that it's done. You want to record that temperature and the time you took it. Again, we're looking for trends over time to see if there's an increase. Then you're going to want to wash the thermometer so it's ready to use the next time. So rinse it in cold water, clean it with alcohol, and then rinse it again. Or follow the manufacturer's directions on how to clean it. Along with a fever usually comes a cough, because it's a respiratory problem. Cough has generally been described as non-productive or dry, meaning it's not creating a lot of mucus. And then another sign that might be apparent for you as a caregiver would be that person having close contact with another person known to have COVID-19, or who has recently lived or traveled to an area with an ongoing spread of COVID-19. So what we've just been talking about is the early recognition of COVID-19 for a person that we're probably familiar with, somebody who is going to develop symptoms of fever and cough. But we may be in contact with people, or we might know of people who have been sick and who are developing some life-threatening conditions. Specific to COVID-19, we're really looking at respiratory or breathing emergencies. And when somebody has difficulty breathing, any signs or symptoms of that, we want to contact our emergency medical provider as soon as possible, and they will help dispatch the right resources for you or give you the best directions. In our next video, we'll talk about first aid and caring for people with COVID-19.